When we talk about mental health issues, sometimes that's like people don't know what that's about. When we talk about physical things, whether it's hypertension, whether it's heart problems, whether it's Alzheimer's, it seems like people can connect to that. But when you talk about mental health issues, people are kind of afraid, and they think that that means that the person is crazy. That's the expression that people use.
It doesn't mean that that person crazy.
Well, you know, sometimes I feel like the elevator of life is bringing me down. I want to go crazy.
Well, all of us have that. All of us have a time where we just have to have a situation resolved. But there are some people that haven't developed those coping skills to get from one crisis situation to the next. And when it becomes chronic, that's when you have to have a professional to step in. Your mom saying it, a friend saying it, a relative. It doesn't have the same impact as having a professional take charge, develop a treatment plan, establish some goals, and get on to helping the person establish good living skills.
Well, one thing I have observed as a primary care physician, and primary care physicians are the #1 access point for initial diagnosis and treatment of mental health services, is that the prevalence of the disease state, anxiety, depression, bipolar disorder, every other commercial on the television now is for a mental health drug. And it is absolutely incredible how many people and children now being diagnosed with the same bipolar, schizophrenia is also quite prevalent. What about younger kids, adolescent kids with the diagnosis of ADD or ADHD? Do you deal with those at all?
The ADD, they would have to have like a dual diagnosis for us to deal with that, or anything like the other diagnoses in the classroom. We want children, like you were saying, that they're just starting to get a diagnosis of bipolar and schizophrenia, which usually used to be in the middle 20s before it got diagnosed. Now we're seeing kids who are depressed, they're suicidal, and they're in the classroom talking about carrying a gun to the classroom. Why are they doing
and doing so?
And they're doing it.
And with the zero tolerance policy, that they're out of school, put in alternative schools instantly and immediately, and once they're on that track, it changes their life forever.